Your liver could be failing right now, and you might not even know it. Fatty liver disease has become a silent epidemic affecting millions worldwide, with over 30% of US adults over age 35 currently suffering from this condition. What makes this truly frightening is that many people have no idea their liver is under attack until it's almost too late. But today, that changes. Let me show you exactly how to spot the warning signs of fatty liver before permanent damage occurs. We'll cover the 17 critical symptoms you must know, who's most at risk, and the exact foods that are destroying your liver right now. Most importantly, I'll reveal proven methods to reverse liver damage naturally, often using common items already in your kitchen. Fatty liver disease is often called silent because it frequently shows no obvious symptoms in its early stages. Yet there are subtle signals your body might be sending, if you know what to look for. The first early sign is stomach pain and heartburn. Research from UFMG has shown that people with hepatic steatosis, the medical term for fatty liver, experience dyspeptic symptoms at double the rate of healthy individuals. These include persistent heartburn, burning sensations from chest to throat, excessive belching, and a constant feeling of fullness. If you've been dismissing these as just indigestion, they could actually be your liver crying for help. The second warning sign is excessive gas. This might seem like a minor inconvenience, but radiologists have noted that fatty liver patients consistently show abnormal gas patterns. The fat accumulation affects your intestinal flora, creating a direct impact on liver function. In some cases, this excessive gas even interferes with medical imaging, making it difficult for doctors to visualize surrounding organs like the pancreas. Pain in the right side of your abdomen is the third critical indicator. This discomfort typically manifests just under your ribs in the upper right quadrant, exactly where your liver is located. As your liver enlarges from fat accumulation, it can press against nearby nerves, sometimes creating referred pain that radiates all the way to your right shoulder. The fourth sign that shouldn't be ignored is unexplained loss of appetite. When fat infiltrates your liver, it triggers metabolic changes, inflammation, and hormonal imbalances that directly affect your desire to eat. This isn't just about feeling full, it's your compromised liver disrupting the delicate systems that regulate hunger and satisfaction. Persistent fatigue that won't go away with rest marks the fifth early warning sign. Your liver plays a crucial role in converting nutrients into energy. When fat impairs this process, your entire body feels the energy deficit. This fatigue intensifies if steatohepatitis develops, where inflammation accompanies the fat buildup, creating a constant drain on your vitality. The final early indicator is unexplained nausea. As your liver function declines, toxins that should be filtered remain in your bloodstream, triggering waves of nausea. The physical pressure of an enlarged liver against your stomach compounds this feeling, creating persistent discomfort that many mistakenly attribute to other causes. But these early symptoms are just the beginning. Let's examine what happens when fatty liver progresses to more dangerous stages. When fatty liver advances, the symptoms become far more serious and visible. The first late-stage symptom is dark urine. As your liver function deteriorates, it releases excess bilirubin into your bloodstream. Your kidneys filter this into your urine, creating a cola-colored appearance that signals significant liver distress. The second advanced indicator appears on your fingernails. White nails, medically termed leukonychia, occur when your failing liver alters blood composition and circulation. The nail bed, normally pink from underlying blood vessels, takes on a pale or white appearance as liver disease progresses. The third serious sign manifests as mysterious red spots across your body. These spots emerge when your liver can no longer produce essential blood-clotting proteins or properly absorb vitamin K. This creates a condition called thrombocytopenia, where tiny subcutaneous bleeds appear as red dots on your skin. Spider veins form the fourth advanced warning. When your liver can't process hormones properly, estrogen levels rise abnormally. This hormonal imbalance causes small blood vessels to expand and branch out visibly under your skin, resembling spider webs, a classic marker of progressing liver disease. The fifth late symptom is intense, full-body itching. as bile salts accumulate in your bloodstream and deposit on your skin.
They trigger uncomfortable itching that typically starts on your palms but can spread everywhere. This isn't ordinary dry skin. It's a direct consequence of your liver failing to process these compounds. Jaundice marks the sixth, and perhaps
most recognizable advanced symptom. The yellowing of skin and eyes occurs when bilirubin, normally processed by your liver, builds up in your tissues. This yellow pigment becomes visible first in the whites of your eyes, then gradually across your skin as liver function continues to decline. The seventh advanced sign is palmar erythema, a distinctive reddening of your palms. This occurs when hormonal imbalances from liver dysfunction cause blood vessels in your hands to dilate abnormally. The resulting redness, particularly at the base of your thumb and pinky finger, signals significant liver distress. Pale, clay-colored stools constitute the eighth serious symptom. Healthy stools get their normal brown color from bile salts processed by your liver. When these bile salts aren't properly produced or transported, your stool becomes unnaturally light, a visual warning of compromised liver function. The ninth advanced indicator is night blindness. Your liver stores and metabolizes vitamin A, essential for vision in low light. As liver disease progresses, vitamin A metabolism fails, creating difficulty seeing in dim conditions, a symptom many don't connect to liver problems. Gynecomastia, the enlargement of breast tissue in men, forms the 10th late symptom. As liver disease disrupts the balance between estrogen and testosterone, men may develop feminine characteristics, including enlarged breasts. This isn't a cosmetic issue, it's a visible marker of serious hormonal disruption caused by liver dysfunction. The final advanced symptom is severe, persistent pain in the upper right abdomen. This pain, far more intense than the mild discomfort in early stages, signals that your liver has become significantly enlarged and inflamed. The pain may radiate to your right shoulder as your distressed liver presses against surrounding nerves and tissues. These 11 advanced symptoms require immediate medical attention, as they indicate your liver disease has progressed to dangerous levels. Early detection of hepatic steatosis allows for complete reversal before permanent damage occurs. Even when scars and fibrosis have formed, catching the disease early enough can prevent progression to cirrhosis or liver cancer. Diagnosis typically involves imaging tests like ultrasound, CT scans, or MRI. While it's normal for your liver to contain small amounts of fat, anything exceeding 5% of liver weight causes noticeable changes in these images. Doctors classify fatty liver in 3 distinct grades. Grade 1 indicates mild steatosis with minimal fat accumulation. Grade 2 shows moderate fat infiltration across liver tissue. Grade 3 represents severe steatosis with extensive fat deposits throughout the organ. Blood tests measuring liver enzymes like AST and ALT often provide the first clue, as elevated levels suggest liver inflammation even before symptoms appear. Understanding risk factors is crucial for prevention and early intervention. Obesity stands as the primary risk factor for hepatic steatosis. Excess body fat, especially around your abdomen, dramatically increases fat accumulation in liver cells. This fat infiltration impairs normal liver function and triggers inflammation that can progress to scarring and permanent damage. Type 2 diabetes represents the second major risk factor. The insulin resistance central to this disease leads to abnormal fat metabolism and storage, with much of this excess fat deposited directly in your liver. This creates a dangerous cycle where liver dysfunction further worsens insulin resistance. High blood pressure forms the third significant risk factor. Hypertension often appears alongside other metabolic issues like obesity and insulin resistance, creating a perfect storm that accelerates liver fat accumulation. The vascular changes from high blood pressure compound the damage to already stressed liver tissue. Excessive alcohol consumption constitutes the fourth major risk. When your liver metabolizes alcohol, it generates oxidative stress and inflammation that directly promote fat accumulation in liver cells. This process can rapidly accelerate liver damage, especially when combined with other risk factors. Sedentary lifestyle represents the fifth critical risk factor. Physical inactivity contributes to overall fat accumulation and exacerbates insulin resistance. creating ideal conditions for fatty liver development. Modern lifestyle changes, particularly the shift from active play to electronic entertainment among children, have dramatically increased pediatric fatty liver cases. Additional causes include certain medications like amiodarone, tamoxifen, and corticosteroids, which can induce liver fat accumulation even in people without other risk factors. The good news is that fatty liver disease is highly reversible through targeted lifestyle changes. Regular exercise stands as the first essential step. Just 150 minutes of moderate activity weekly significantly reduces liver inflammation and fat content. This represents a critical intervention, especially considering how sedentary lifestyles have contributed to fatty liver becoming common, even among children. Weight loss forms the second powerful intervention. Shedding just 5% of your body weight delivers remarkable benefits for liver health, including reduced inflammation, decreased fibrosis, and significantly lower hepatic fat levels. This modest weight reduction can halt or even reverse disease progression. Alcohol reduction or elimination constitutes the third essential step. Alcohol directly damages liver cells, hepatocytes, and accelerates fat accumulation throughout the organ. Removing this toxic burden allows your liver to focus on healing and regeneration rather than processing alcohol. Dietary modification represents the fourth and perhaps most important intervention. The foods you consume directly impact liver health, with certain choices promoting fat clearance while others accelerate fat accumulation. Let's examine what to avoid and what to embrace for optimal liver recovery. Certain foods dramatically accelerate liver damage and must be eliminated if you have fatty liver disease. Ultra-processed foods top the list of liver toxins. These packaged and fast foods contain dangerous combinations of sugars, saturated fats, and chemical additives that directly promote liver inflammation and fat deposition. Every ultra-processed meal creates a new wave of stress on your already compromised liver. Refined wheat products form the second category to eliminate. Foods like white bread, conventional pasta, and crackers cause rapid blood sugar spikes that worsen insulin resistance, a key driver of liver fat accumulation. These refined carbohydrates convert to liver fat more efficiently than almost any other food. Fructose-containing products constitute the third major threat. While natural fruits are beneficial, processed fructose found in corn syrup is devastating to liver health. This ingredient, hidden in sodas, cereal bars, boxed juices, ketchup, and jellies, has been identified as the single greatest dietary cause of fatty liver disease. Added sugars represent the fourth critical category to avoid. Sugar directly feeds fatty liver development by triggering insulin resistance and providing excess calories that convert to liver fat. Eliminating added sugars from your diet creates immediate benefits for liver function and fat clearance. Certain vegetable oils form the fifth category to eliminate. The modern diet contains excessive omega-6 fats that promote inflammation, while lacking omega-3 fats that reduce it. Many common vegetable oils contribute to this inflammatory imbalance, accelerating liver damage and fat accumulation. Just as certain foods damage your liver, others provide powerful healing properties. Turmeric stands as the first liver healing superfood. This golden spice contains potent anti-inflammatory compounds that directly combat liver inflammation. 4. Maximum benefit. Always consume turmeric with a pinch of black pepper, which enhances absorption by up to 2,000%. Whole grains represent the second category of liver healing foods. Unlike their refined counterparts, whole grains like oats, flaxseed, and chia provide fiber and omega-3 fatty acids that reduce liver fat and inflammation. Research shows consistent consumption of these foods significantly lowers hepatic steatosis risk. Coffee emerges as the third surprisingly powerful liver remedy. Rich in caffeine, tocopherols, and chlorogenic acid, coffee provides potent antioxidant protection against liver inflammation and fibrosis. Studies show that regular coffee consumption correlates with reduced liver fat levels and improved enzyme profiles. Olive oil forms the fourth crucial addition to your liver healing diet. Consuming 3 to 4 tablespoons daily significantly reduces liver fat accumulation while providing anti-inflammatory compounds that support overall liver function. The monounsaturated fats in olive oil help normalize liver enzyme levels and improve fat metabolism. Specific fruits constitute the fifth category of liver-healing foods. Avocados stand out due to their high glutathione content, a powerful antioxidant that directly combats liver fat accumulation. Other fruits provide fiber and antioxidants that support liver. Detoxification pathways. Cruciferous vegetables complete our list of liver-healing foods. Broccoli, Brussels sprouts, and cauliflower contain sulforaphane, a sulfur compound that reduces liver inflammation and even fights liver cancer development. These vegetables activate liver enzymes that accelerate the clearance of toxins and fat. If you're concerned about fatty liver disease, implementing these dietary changes alongside regular exercise and weight management can create dramatic improvements in liver health. Even advanced cases often show significant improvement within months of these interventions. So what's your next step? If you've experienced any symptoms mentioned in this video, or have risk factors like obesity, diabetes, or high blood pressure, consult with your healthcare provider about liver function testing. The sooner you identify and address fatty liver disease, the better your chances for complete reversal and recovery. Have you noticed any of these symptoms or made dietary changes that improved your liver health? Share your experience in the comments below. Hit the like button if this information helped you understand fatty liver disease better. Subscribe for more videos on protecting your health naturally. And check out the video on screen now to learn about other hidden health dangers you might be overlooking. Your liver health is worth fighting for. Start making these changes today.